Hi, everybody. Welcome to GW Center for Integrative Medicine. I'm your host of this Zoomcast, Dr. Mikhail Kogan, Medical Director of the Center, as well as Associate Professor of Medicine at GW. If you like this channel, please subscribe so you catch up on everything. I'm trying to keep all of the updates on integrative medicine and actually on lots of different health and illness-related topics within pretty brief period of time. So for example, today I'm going to be reviewing a very interesting study in a specific context. So let's jump right in. I'm going to try to keep this video as short as I can. So a couple of days ago, I saw a very unfortunate patient. Is a very young, very athletic woman, a physician who had before COVID that she contracted in January, she had a kind of a chronic, mild, ongoing illness that was categorized as some chronic fatigue, abdominal discomfort, some sleep disturbances, some headaches, muscle aching. Some terms like fibromyalgia were thrown around, migraine headaches, et cetera, et cetera. Nobody actually met with patient and actually asked her what the time frame was, if they realized that all of the symptoms started about 2 to 3 months after she had two back-to-back floods, one in her home and one in her office, and pretty much everything cascaded after. So basically, without even doing additional testing, most likely it's a basically diagnosis of exclusion that she had a chronic mold toxicity, and then in January this year she developed this acute COVID. So the problem, what happened after that? So about 3 months later, she developed a pretty severe POTS, what we call it, postural orthostatic hypertension. So she basically, anytime she moves quickly, she gets up, she tries to exercise, she has severe dizziness, weakness, and almost passing out. She did a full workup. So she did a tilt table test, which came back inconclusive. She was, by her primary care doctor, sent to cardiology. She's seen about a half a dozen physicians until she saw me, and no one, this is the problem, no one had mentioned that this could be a COVID related. It's very painful to see what happened with our own fellow physician. And despite that, the patient herself kind of questioned several authorities saying, could this be COVID? And everybody said, no, absolutely not, because it would have happened right after you had COVID, the long COVID consequences, or what we called POTS, or just a vagal dysregulation. Yes, and it's kind of unfortunate. Of course, I told her immediately, I don't need any tests. This is what you have, and we have to work on restoring the vagal nervous system, supporting your central nervous system with a number of nutrients, looking into a potential of mold toxicity, even though she's out of the house and where that happened, but still, you still have to treat and detoxify the system. But more importantly, you really have to try to support her nervous system as much as possible. And she's very athletic person. Her base heart rate is 50, 55. So I think that's why the tilt take, so that's why the official diagnosis wasn't established, because she's so above an average that when they applied a test to her, it didn't really perform as they were thinking. So what I want to show today is this study that actually shows how COVID causes the nerve damage, and how it leads to what this term called dysautonomia, which basically means the vagus, it's a big nerve that supplies all of our body, basically. The vagus nerve controls this autonomic responses. So you start exercising, your heart rate picks up, goes up, and it should be able to provide enough blood flow to the brain, to the muscles, to wherever they need to go. But dysautonomia is this kind of discoordination where you can't really effectively, through the nervous system, send the right signals. So the signals kind of go, they just kind of get weird, and the heart rate cannot pick up in time, or it goes too fast on the other hand. Blood pressure doesn't go up when it needs to be, and so the person feels dizzy or lightheaded, etc. So it's a pretty significantly, it's a decent European journal from my understanding. I didn't look much into it. But what they did, this is an actual experimental work. So this is not a theoretical framework. It's an actual research. So what this team did, they looked into the histopathology of the nerve tissue for some time after the development of COVID. So they took 323 patients. It's a pretty big size. And those patients had a clinical phenotype of dysautonomia. So, they could have had very severe heart rate upregulation when they get up, for example, or they may have had some shifts in blood pressure that were inconsistent with a normal autonomic response, etc. And, so what they did is they looked at all of them. They did a variety of different tests. And then they actually looked into, well, what actually happens on the level of the vagus nerve on the pathological level. And basically, in essence, and I, of course, will put the link to this, but in essence, it can be summarized as this. The continuous long-term vagal nerve inflammation drives the neuronal stress, and the nerves, the vagal nerve doesn't die, but it doesn't perform right. And it could be months after the onset of COVID. So basically, the whole story, just exactly what happened to my patient. And I hope that some of my colleagues will see this video and realize that you really cannot rule out long COVID in a patient who developed POTS-like symptoms 3, 4, 5 months after the COVID. And in fact, most likely all of the patients presenting after the COVID with any autonomic dysregulation, you can link that back to the COVID. And you have to, actually, because otherwise you will be pursuing other venues of diagnosis, which are going to lead you nowhere and more likely potentially going to harm the patient because there's going to be additional tests that are going to have no value of any kind. It's important to recognize what kind of inflammation. So this is NK cell modules and then monocyte modules. And the issue with that goes like this. There are very little treatments that we can offer in a standard of care that's going to treat this. On the other hand, the typical standard anti-inflammatory approach that we can use, some herbs like turmeric, for example, anti-inflammatory diet, aggressive stress reduction, acupuncture, things like other spices like saffron, for example, green tea, etc. So all those regulating NRF responses. So all of those things we know can curb down the inflammatory response. There are also some interesting molecules that now can combat interferon-induced inflammatory responses. But in reality, we really need to look at the patient holistic, and that particular patient I mentioned, most likely, in addition to directly trying to lower her inflammatory response, we're also going to aggressively go after looking for mold toxicity, because that itself spikes this, what we call the chronic inflammatory response syndrome, and I'm sure it's playing into this as a part. So interesting article, take a look. It's very detailed. It's got a lot of different information if you're really into this kind of assessment. And in essence, again, as I say, the mechanism has been established. The mechanism that the COVID virus directly starts causing long-term inflammatory response that propagates even though the virus is long gone. And in some individuals, that it's particularly this vagal system that causes this dysautonomia. And in our continuous long COVID groups, we cover this topic in different angles. So we give different tools. For example, we often give tools that are more mind-body based, but then we give acupressure tools. We give natural product tools like, well, how much fish oil should I take, or what kind of fish? So should it be SPM, Resolvin versus the fish oil? Should it be both? I mean, all of those questions come up all the time. And this is really the depth of work that we engage with the patients. And I think the last thing I want to bring up is, we feel strongly that a lot of this autonomic instability occurs because patient also feels in isolation. They feel not heard. That stress of not knowing what's happening and how can I get better is adding the layer of it. And that's why I think we're so aggressive at making this as a group support. And we've been quite successful, and even just coincided today. Today we're presenting our work, our group approach work, at the National Conference on Medical Group Visits, and I'll make sure I'll put the link to that conference in the link as well, just so you can check out what kind of work other places are doing. And what kind of group approaches are out there in the country and beyond. So I hope this was helpful. Again, please do subscribe. I'm going to try to ask you to subscribe to this channel all the time. Apparently, supposed to do that. I had a consultation this past weekend about making this YouTube channel better. So hopefully over time you'll see some improvements happening. I'll see you soon, covering whatever is important in the field of integrative medicine, whole health, and anything else that is current and important. And then, of course, we will be always covering, in addition, topics of dementia or neurocognitive impairment, climate change, and then spirituality. So those are some of the key aspects that we'll be continuously diving in deeper and deeper. And of course, healthy aging, as many of you know, that's one of my personal interests. So, or rather integrative geriatrics. Stay safe. Sounds like it's going to be a wonderful weekend, and I'll see you soon on this channel. Take care. Bye.